Let's talk rural and remote medicine. 72% of Australia's population live in major cities. But what about the other 28%? In 1997, ACRM was established in response to the growing healthcare crisis in rural and remote Australia to train and support rural generalists in a broad range of medical disciplines. So these doctors are prepared in any situation, keeping care closer to home. Today, ACRM is leading the way through advocacy for training support, putting more doctors where they're needed, and providing access to quality healthcare for communities outside the urban footprint. And with this fellowship program, training doctors to work in unique rural and remote medical contexts as rural generalists. Meet Brian and Phyllis, ACRM rural generalists that live in the remote town of Nhulunbuy, the most northeastern point of the Northern Territory, to hear about the unique lifestyle and experiences that come with being a rural generalist.
The Northern Territory is a very sparsely populated area.
So the population here is a mix of the Indigenous and non-Indigenous population. Everyone works together as a team because Nhulunbuy is small and everyone's quite aware we all need to look out for each other. So I think when the chips are down, that's where Nhulunbuy comes out at its best, and I think that's another aspect that makes it very attractive to work in.
Coming and working in the Northern Territory, even outside of Darwin, is a really good place for initial training in whatever health field and discipline that you may end up being in, just because I said the unique presentations and the variety of things that you have to deal with.
For example, yesterday we were getting on with our day, doing routine colonoscopies, having a very nice time. Then we heard that there was a man who fell over and had
A severe fracture of his lower arm.
The bone was actually sticking out. In the city, you would try and get that washed out and cleaned within 6 hours.
And due to distance and complicated area medical requirements, they weren't able to get to us quickly. And due to the mix and the diversity of skills of our rural generalists,
We realised we could pull resources together.
we were able to take him to an operating theatre and
Actually set it in plaster so that he'd be more comfortable and the wound clean.
eventually area medically evacuate him.
So I think as a rural generalist, if we can provide that sort of service, it is helpful and great for patient care.
What Australia needs is more doctors that want to make a difference in the lives of people living in remote and rural communities. So what do you think? Do you have what it takes to be a rural generalist in the NT?